So I think before we are able to continue, I would love and I would be honored to welcome our panelists to give us a beautiful round of introduction with a little bit of a twist. So I'm thinking, not only do you describe who you are as a person and what you feel about yourself, describe what you're wearing today. Describe what you're feeling today. Describe why it is important for you to be here and what does it assist you to achieve. And importantly, describe to us why Africa, why now. Thank you so much and welcome, my panelists. Let's have a round of applause, please. Over to you, Tim.
Yeah, good morning, everyone. Yeah, my name is Emmanuel Ngulube. This morning, I'm wearing an African black shirt with an embroidery in front of me and a cream white trouser with black shoes. I put on glasses with a bit of a beard and a mustache. Yeah, Emmanuel Ngulube works for World Vision Zambia as a gender equality and social inclusion, gender-based violence programming advisor. And I've worked in that role both as a donor as well as program design. Currently also supporting the organization in terms of integration on all these issues, including disability inclusion. What was the second question? Why here? I'm excited to participate at this conference, and it's my first time. And why basically here is that having interacted with work around disability, that changed my programming altogether. I thought I was an expert in programming, not until I faced issues around how we can do better on inclusion. That changed it. So I'm a transformed person, and I'm here just to testify that and to enjoy the moment, to learn more, and intensify that both at the continental level, at regional level, and different country disability inclusion framework level. So I'm excited to be here. Thank you.
Thank you so much. Round of applause. Over to you, Madam Faustina.
Thank you. Thank you so much. Habari. This is Faustina Urassa from Tanzania, in Kilimanjaro region, under the highest mountain in Africa. I am the founder and executive director of Songambele Initiative organization, an organization which is working to support people with disability so that they can live independent life with dignity and happiness. I am a wheelchair user, and I was involved in a car accident 24 years ago, and been told that you'll never walk again. So the challenge I face, discrimination, isolation, GBV issues, I thought there is important to come up with an organization where women, girls, and children, however, we also include men, we can sit together and talk about the issue we are facing and come up with our own solution together with other community and the people around us. I'm very great to be here. I feel honored. My wheelchair is different compared to any wheelchair you have seen or touched. It has 2 big wheels and 1 small front caster. So I feel comfortable with it. This is local made in Tanzania. I'm happy to be here because I want to show my fellow women, ladies, there is life after spinal cord injury. Life doesn't end because of disability. No matter how difficult it is, we have to move on. The meaning of the word Songambele, that means move on. Cry and cry. Don't give up. Stand up and keep on going. good to be here. Thank you.
Thank you so much. You're welcome, sir.
Good morning, everyone. Okay, my name is Dan Matakaya. Let me stand. Okay, I'm wearing a cream, African wear with black shoes. I'm totally blind, and I'm happy to be here. I work as a cop, a police officer, and before this, I wasn't born this way, but I acquired my disability in 2013. And before that, I used to work with the Criminal Intelligence Unit as a detective, which I still do. And I'm also the director and founder of Shieshie Foundation. This is an organization which I founded in 2019 because I realized as a man, after going through violence, I'm a survivor of gender-based violence. And this happened one day. I went to the house after my shift, and when I went to sleep, my ex-wife woke up and poured sulfuric acid on my face. That's why I lost my sight. But this was a new era in my life, because it took me quite some time to reach where I am and to impress the new me. And that's why I founded Shieshie Foundation, to create a safe space, because during my treatment journey, I realized that many men were suffering. They were being abused, but in our culture, we have not given men that space where they can come out, they can express their feeling. So I realized that there's a gap within our society, and that's why Shieshie Foundation came in, just to fill that gap, to create that safe space for any man, for any boy child who are facing abuse in marriage or in relationship, to find somewhere they can pour their emotions, somewhere they can reach for help, and to also feel that someone is taking care of their grievances, just to amplify their voice. So, and currently we are having a toll-free number, 1198, where men can call any time of the day, any time of the night, and get the support of counseling. We have a pool of professional counselors who offer help. I'm also a counseling psychologist, and I had to do this course because many people, many families were reaching out to me when they saw my story. They were telling me, Dan, come and talk to my son, come and talk to my brother, because they saw what they are facing, what they are going through in marriage. And since the society has labeled men as perpetrators, so there is no space where they could come out and talk, because when they talk, they face a lot of stigma. And we know how our culture is. So I'm happy because at least I know I'm changing life. I know I'm a voice to many, many men who are being abused and who are not able to talk. I'm there to speak for them. But as an organization, we realize that we are also getting many cases of women abuse. And then we say we cannot send them away. So we also have received cases, we refer some of the cases, others we handle. So I'm happy to be here and to discuss this topic as a survivor of domestic violence. And I'm happy for this conference, because I also learned that now people with disability, they are more vulnerable to abuse. But who is taking their problem, who is there to solve their problems? And we say that we will be handling the cases of abuse from the people with disability, and also to take the data, so that if we have the data, we can be able to reach out even to people to come and support us. We also do sensitization for people. I know we have many youths who want to get into marriage. Some of them don't understand what is marriage. They expect good things in marriage, but when they read there, they realize that marriage is a different thing. So we also sensitize them on what to expect in marriage. So I'm happy. Thank you so much.
Thank you so much, Dan. A round of applause. So I think we would quickly want to have this discussion in a very different way, because I was thinking, again, I'm a person that wants to have our audience still participate in decision making in the panel. So I was opting, let's have each and every speaker go through a question at a time to have a more deliberate and more expansive deliberations, and then so that we can be able to create more time for Q&A and still have that adjustment run across. Is that in order? Is that democratically okay? Okay, great. So I think my first question, of course, and I didn't do my introduction. I am Zaha Indimuli. I am a Gen Z by heart and by nature. I run an organization called Amali. Not only do I work in the space of gender-based violence and in the fight against different varieties of violences across the country, and with the current work that we did being the femicide work, and I think Kenyans would attest, we were able to mobilize more than 20,000 women across the country on this big fight against femicide. But that in many cases, Amali is just a youth organization full of experts trying to bring out the aspect of professionalism in decision-making and advocacy. We're a group of around 2,500 young individuals across the country and the continent, and very much honored to be here to participate in this discussion. So back to my panelists, I think I'll start with Emmanuel, and also for the amazing description of your work. Inclusive Africa Conference, and right now in the age of digital inclusion, where we're looking at how different can we get in works around advocacy and awareness, and especially in the context of breaking the silence on gender-based violence for persons with disabilities. And what role do you think awareness plays in fostering inclusivity? So looking at this conference, how much more do we have to go? What can we be able to improvise to be able to utilize these spaces in a way that reflects back to the types of works that are being done by persons with disability and their organizations and various communities that are working towards the fight and breaking the silence within GBV?
Wow, that's a loaded question, isn't it? Yeah, so having attended a number of conferences, this one is exciting, and I'm very hopeful. I'm very hopeful that this conference will not end here, or such a conference will not just end like this, but we should be able to be clear in terms of our deliberations after this. So as I outlined earlier, we have different bodies at continental level, at regional level, and so forth. So the question is, how does Enable Conference feed into, through those structures in our governance system as Africans? We do identify gender-based violence as an emergency, as a priority for those who know it at professional level, but most especially at experiential level, where this is happening right at individual and community level. So for me, Enable should bring up a platform where we should be able to bridge that gap, where strategies here can speak to what is happening on the ground, can appeal to a survivor of gender-based violence and make sense. And if our policymakers can understand that, then we can move to another level. So what is happening at the moment is that conferences end like this. I'm sorry for that. I'm very passionate about this. We'll take our tea here, nice meals, say hi, exchange maybe business cards and so forth, and we go back and sit down. So for Enable or this conference, my appeal is that we have to look. I'm not very sure about its capacity, but if there is a gap, we need that capacity for this coordination so that we have teeth to bite at all these levels, at intercontinental body level, African Union level, at regional bodies level, so that our voice is integrated into all these frameworks, which we already know. Otherwise, they'll remain frameworks forever. Even my children, my grandchildren will find them, but nothing really happening. It could be good to look at these documents, and they are exciting. But when we talk about implementation, we'll talk about disability implementation against gender-based violence being expensive. But what does expensive mean? What does that mean to somebody in a community? So those are hard questions that we need to ask, not only ourselves as implementers, but also as decision makers. The first thing, I think in the area discussion, somebody mentioned it, should have been Ambrose in on the previous discussion. Where are women with disability in decision-making structures? Do they participate? Or it's me, Mr. Ngulube, who is there to raise a voice for them and presume I do understand what they go through. So inclusion should start with that. They need to participate in all strategy development. And how does Enable Conference push that platform, that enabling platform, that women with disability who are survivors of gender-based violence are up there to speak or to participate in that decision-making. Assumptions have always been the best killer of this process, assumptions. So we can't get anywhere with assumptions and pretend that we do understand that we have the best trained people to make designs of programs, even source funds, and so forth. Secondly, this should go with corruption. Sorry, I'll use that word. In every program design, there are risk assessments within it. Sometimes we raise funds to prevent gender-based violence among women and girls with disabilities. But it's me, Mr. Ngulube, who is able-bodied. May I use that language? Yeah, without a disability. Who calls myself a champion. But deep down my heart, I don't have the passion really to end violence against women and girls with disability. So that risk assessment should really be done correctly and be able to identify the right people to drive that. So not to close, looking at time, my friends, I'll leave it there. But allow me just to mention one point at implementation level. So at implementation level, through assumption as well, is for all of us to believe in the survivors of gender-based violence. We don't believe in them. Their stories are stories, and no one wants to take those stories seriously. I think that change of our own mindset to believe in them will help us do better strategic planning around it.
Thank you so much. I think that's a very interesting perspective, checking out our needs assessment in programming and creating strategies towards preventing gender-based violence. I think over to you, Madam Faustina. What innovative strategies and collaborative efforts can be employed specifically to empower marginalized communities and ensure that their voices are heard in the fight against gender-based violence? And in this context, what type of innovation can we be able to dive into to solve gender-based violence cases, especially amongst persons living with disability?
Well, I'm going to talk myself a bit and then, yeah. As I said, I was involved in a car accident 24 years ago. It was not easy to be told you never walk again. To me, it was a death sentence, as I said. But also, it turned out that I was pregnant, and I didn't even know. So I was told you will never be walk again, and you are pregnant. So that is when I realized I'm not living in the same world. And this is because even when I was going to the clinic, the nurse will call their colleague and say, look, she will never be able to walk again, and she is pregnant. Yes, I didn't know I was pregnant. I was 5 days. I know specialists will say there is no 5 days. pregnant. But I remember when I conceived, I remember. So that is when I started facing a lot of challenge in the JBV. I remember, to cut a long story, the day when I was at labor ward, one of the nurses came, looked at me and say, this is another, maybe say Mary, but it is not the actual name. But it was a strange name, like, this is another Mtinga. I remember that word. And then, after I was delivered, that is when I asked, what was the meaning of the name Mtinga? And one of the nurses who was very close to me told me, there was another lady who went through the same situation, give birth here, so she was comparing with you. So we have difficult names, they call us. So what I wanted to say is, for women with disability, for people with disability, the first support should come from the family. Means my family were there all the time to support me. And thank God, I had a very beautiful baby girl. She's a girl now. She's beautiful just like me. So, what I want to say is, the way your family treats you, that is how the community can treat you. Because I remember I lost everything. I was about to join university. I lost friends. I lost some of their neighbors. I lost people I love. I gave them, someone I loved, give that part of my heart and my body. But when he realized Faustina will never be able to walk again, he took off. For me, it was okay. I was like, what is he going to do with a disabled woman? By that time, I was in denial. You can imagine how difficult it is. You have rehabilitation. You cannot go to washroom. You cannot transfer from your wheelchair to bed. You cannot turn. You don't have a wheelchair. You don't. Spinal cord injury is something else. You cannot control or fill your bowel. You cannot bladder and a lot of things. You are in fear. You can develop pressure ulcers. You are in fear. You are going to die and other stuff. But my family was there to support me. So what I want to say is, and I can say the community around me respect me a lot because my family were there protecting me, encouraging me, telling me, Faustina, don't give up. We are here for you. So, what innovative strategies and collaborative effort we can use? When you talk too much, sometimes you can forget to go to the point straight. So bear with me. Community-led initiative, but starting in the grassroots level is very important, because majority of people with disability who are facing gender-based violence, we are living in rural areas. In rural areas where information, education, awareness about the GBV is very minimal. But the understanding of people with disability, especially women, we are not included in so many things. As women who are able-bodied, for instance, you don't have a disability, or we don't know you have disability, you are fighting for your right. There are some challenges you are facing because you are a woman. For women with disability, we are facing this multiple times. First, we are women. Second, we are women with disability. That means we are weak of the weakness. We cannot talk about ourselves. We don't know our needs. We don't know what we want. For instance, if someone comes and see me, instead of asking me, Faustina, do you want some water cold or warm? He will go to my daughter or my granddaughter and ask, they think that I cannot speak up. And this is because, again, for women with a disability or people with a disability in general, we have very low self-esteem. You cannot speak because you cannot be listened. You cannot give an opportunity. So always we have to fight. We have to fight and shout. So community lead is very, very important, especially in rural areas. In Kilimanjaro, Tanzania, we have Songambele specifically, we have been using what we call peer-to-peer education. It's very encouraging when you are talking to someone who is in the same situation and who is going through the same thing you have gone. So experience sharing, encouraging one another is vital. And this, by using peer-to-peer, people with disability together with the community, that means there will be a sustainability at the grassroots level. Because most of the time when we are talking about gender-based violence, we are thinking about at the level of national and forgot about the grassroots where most of people with disability we are. So I think this is important to make sure that there is training, awareness, and mentorship so that people with a disability can come out, raise their voice, and so that they can be included in all programs. But everything, like a program that have been designing for about gender-based violence should be inclusive so that everyone can be able to understand and to pass the message and to be ambassador. So it's very important to have people with disability themselves, female men, who can advocate together with able-bodied. I can say that people with disability, we are, and we will be. So include us.
Awesome. I think that really takes me back to the discussion we had yesterday, that there's nothing with us without us. So that implementation and inclusion of persons with disability on the mainstream of our work in advocacy and awareness becomes very important. Thank you so much. Mr. Dan, I think, first of all, thank you so much for sharing your story. And I think deliberately, I would want to just have this question go to you. So looking at building a safer and more compassionate society, and how important it is to have collective action in this regard. How can partnerships be facilitated, and how can collaboration among diverse stakeholders, including government bodies, NGOs, companies, corporates, be it public or private sector, how can all these partnerships effectively tackle gender-based violence and create lasting change? I think when we talk about digitalization of work, we really have to step forward and look at sustainability. How do we use partnerships to create long-lasting and sustainable works around preventing GBV? And in that regard, what role do you envision for these institutions to break this chains of gender-based violence? Thank you.
Okay, thank you. The way my colleagues have said, first I believe that violence only thrives in silence. You know, when the perpetrator abuses you, and then they realize that you don't have anywhere to run to, they get more power. So they control your life. So, and I want to say that issues of GBV is an issue that we talk about, but we don't do much. We talk about it, but when it comes to resources, we don't have resources to fight gender-based violence. First, from the government, and maybe let's say from the judiciary, we need to have laws that perpetrators, if you are a perpetrator of GBV, we need to have strict penalties whereby you don't go to court, then you come out tomorrow, you continue with your life. You know, we have been talking about women, and I'm happy my fellow panelists has talked about it. Women, they are weak. But we talk about women, we don't talk about women with disability. You know, those are two things. So I realized that even when I attend seminars, you realize that we talk about issues of people with disability in their absentia. We don't even call them to come and give their perspectives. We make policies to solve issues, gender-based violence, but we don't involve those victims or perpetrators. And even some of the people who are formulating those policies, some of them are victims, but they just keep quiet. They don't put things that will support and help us end cases of GBV. So what I would like to urge is that partners and even government entities to join hands together and come up with proper measures to try and end this vice by even putting more resources, creating more awareness, because we talk about GBV in the boardrooms, but we don't go to the grassroots. We need to give instruction to the administration on how to handle, to tackle issues of GBV with dignity. You know, we also need to handle the victims with dignity. Because from where I work, I know with the Kenya Police, we have gender desk, but you know, this gender desk is manned by somebody who has not been trained on how to handle the survivor. Maybe you come there to report, like, I've been abused. They start asking you like questions that you feel they are not good. Like, why did you do this to enable this person to abuse you? You know, such questions, they demoralize people. And even from the hospitals, I think many people have gone there to get treatment, but they have to say that maybe they were attacked, because, you know, when you talk about abuse, some people, they start laughing at you. There's a lot of stigma. So those are the things we need to handle. Let's sensitize even the service providers, from the police to the hospitals, the health providers, so that even when this victim comes to seek for help, let them feel that, okay, they have been catered for. Let them be treated with dignity, and let them get support. Let's tackle the issues of corruption, because that is something that is killing the war against GBV. Corruption is rampant in the system. So when even someone reports, you realize that the perpetrator goes on court-free. They say there's lack of evidence, and then because of corruption, you realize that they go away scot-free, and then you remain there as a victim. You don't get the needed justice. You know, just when you get justice, it helps you even to heal from your heart.
Yeah.
But when you don't get justice, they start even laughing at you, like, you reported, you went this, you went to court, what have you achieved? You know, it still demoralizes the victims. So as we formulate policies, as we try and fight this mess, this vice that has been there for generations,
Yes.
let's involve people, let's involve survivors, and let's come up with policies that will enable us to end gender-based violence.
Thank you so much, Dan. I'm seeing we have 10 minutes, and strategically, we wanted the last 10 minutes to be thrown back at the audience. So I'm going to use the 5 minutes to have it this way, and we can have suggestions going on. I'm thinking we can have 3 questions from the audience. Please let us direct it to specific speakers. And if one speaker has already been directed a question, unfortunately, you'll allow us to have just every other speaker have one. And then for the 3 questions that are going to be answered, maybe our speakers, you can also give an answer together with your parting shot so that we're able to also keep on time and ensure that other spaces also equally have time to have their sessions. So over back to the audience, do we have any questions for our speakers before we do wind up? Yes, sure, we can have the mic passed. Let's have 3 questions to each specific speaker, kindly.
Right. Greetings, everybody. I am Mr. Tap from Skills Village Radio in Soweto, South Africa. I was touched by today's discussions, and this question was it's less of a question, but anybody, I think, from the panelists who's willing to answer well. So I'll give you a typical example and my understanding as the station manager of a radio station, an online radio station that advocates for the rights and awareness of persons with disabilities. We have a specific show which is called, it's meant for gender-based violence. And what we have realized is that we often see gender-based violence placed on persons with disability, on women, right, and children. And men do not speak out, especially those with disabilities. And I'll tell you why we have experienced. I'll keep quiet as a man. I won't speak out because I think my wife will divorce me. That's one point that we experienced with the guy who came to our radio station. Guys, I'm a blind man, but I'm abused in the house. My wife sometimes comes with a man to the house. But should I speak a word, that I'm afraid that she'll divorce me. So what can we do as persons with disabilities, especially as we have united as Africans? What can we do together to curb this kind of behavior regarding men, especially regarding persons who are basically abused? And going deeper in it, gender-based violence it's not only on domestics and so forth. We have a case currently in South Africa where we have 3 guys, one 17, the other one is 20, the other one is 31. Those guys are visually impaired. They've been locked in their house for close to 5 years. We only found out last year when their mother passed on that these kids have been locked in for close to 5 years. They don't know anything. They can't behave. They don't know this like sunlight. I can say it like that. And that's basically gender-based violence for persons with disabilities. So with those points, can you kindly advise as to what can be done as Africans, more than just a country or as individuals? So
Yes.
I'd love to see what we can, because I know it's possible. We have initiated some thoughts and taking of this one, because I know it's very possible. As a radio station, we have done it. We've managed to open doors and make things possible. So let's unite as Africans and make it happen, because it's possible. And let's tell our own stories the way we want to hear our own stories. Thank you so much.
Thank you so much. Maybe that is a question that could really go to Dan, if that's okay. Let's have all questions being asked. The next one, yes, please.
Okay, hi guys.
Hi.
My name is Karen Muriuki. I'm autistic. One of the key things that I feel about this topic, this is a very important topic that should be discussed. Now, one of the things that needs a lot of attention for is gender-based violence among women with psychosocial, neurodevelopmental, and intellectual disabilities. These are the groups of women with disabilities who have been underrepresented for a long time. And many times these women do not have a voice to, say that, yeah, I have a disability, I have a hidden disability, yet I cannot tell that there's somebody who has violated me. There's some very serious cases that I would really talk about. There's been some very concerning cases that involve women with such disabilities. And my questions to any panelist, have you ever encountered such a case of even men with hidden disabilities who have been, with neurodevelopmental disabilities who have experienced such. Has any one of you done any policy to address the needs of persons with psychosocial, intellectual, neurodivergent, and intellectual disabilities, especially when it comes to gender-based violence?
Thank you so much. Madam Faustina, I think that would be a question you'd take up. The third one, kindly, I think yes, sure, let's have the mic passed over that. Oh my, I know we have so many questions, maybe as something that we can be able to take up because we are out of time, but if we can have them in writing and still have a little short briefing outside with the rest of the panelists, I think it should be great. Over to you.
Thank you. My name is Tabi, and my question actually goes to, I don't know who hasn't gotten to answer a question, but you can decide. But it's about technology. How can we leverage on technology to accelerate the voices of those who have undergone gender-based violence? And just demystify that gender-based violence is not just actual physical harm, yeah, but it goes beyond that to emotional and all the things that we've had. So how can we leverage on technology to ensure that we accelerate the advocacy, you know, tell our stories as a region? Thank you.
Thank you so much. Unfortunately, I'm limited. I'm so sorry. I'm very sorry. Please, I'm so sorry. So I think over to the panelists, maybe we can, and I think maybe we can pass them over in writing if that's okay. Okay, it's a comment? Sure, have the mic, have the mic.
I'm very sorry, no time is limited, but my name is Ghaida and I'm from Mombasa. Based on what she said, I'm actually working on something as well called Girls iSave, a web application that allows report making and connecting young women and girls in the society on issues of gender-based violence, FGM, and teenage pregnancy. So I feel like leveraging technology is something that I'm already working on to provide such a platform that will be accessible to everyone in Kenya, to be specific, and also across. So that is something I would like to share that I'm working on, and soon we will also be talking about it. Thank you.
Awesome. Thank you so much. Maybe we can have the answers, and then for our speakers, I think we can take a minute each. We answer the question, and importantly, just take a parting shot so that we can now, of course, wrap up. Thank you so much.
Yeah, maybe I go first just to tackle this same question where we need to leverage technology and so forth, take advantage of that and see how best. So in programming around gender-based violence, I think we all know it has been on both sides of the response side and the prevention side of things. And you'll find that, for instance, connected to my brother from South Africa, you have Vuvuzela centers, which are very highly capacitated in terms of reporting and providing service, both online as well as in person. And other programs here in Kenya, I know the one-stop centers, you call them coordinated centers around gender-based violence. We have done the same in Zambia as well, and many other countries, Malawi and so forth. But if you look at this, it's about having services under one roof where somebody goes. What about a woman with disability who can't even go to such kind of a center? Okay, can we have a technology that will help somebody within their location be able to report and service come to their doorstep? And all the principles around it be followed. I mean, all the core principles, all the issues around confidentiality, do no harm and so forth, be in place. How do we enforce that? So that's where we really need to work together, people in technology and people in programming, but also the legal people to be around this. And such a platform like this one, that's where, okay, today is the final day, but for instance, if this session had a breakaway session on the way forward, where 3-4 people who feel, okay, we can contribute to this, have that done and pick that up to different levels. So I think I'll leave it there. Because I have an experience where this man was saying, okay, you have said it, where his wife brings, okay, a partner while he's looking and he can't do anything. But in my experience, it was the other way around, where this couple, they're both physically disabled, but a perpetrator takes advantage of a woman, but the man can't do anything to protect his partner, and so forth. How can he use technology? How available is that technology for him maybe to call for help? Thank you.
Maybe your parting shot before you have a parting shot. What's your call to action? What is your clarion call?
Yeah, so my final call to action is that gender-based violence does affect everyone, including children, different partners in every relationship, and therefore we need to put our heads together and unite to find a concrete and effective strategies or innovations around this. So with that, I would call for more investment around the prevention, especially side of things, of gender-based violence. Because at the moment in Africa, I think we have somehow advanced in terms of identifying the drivers. So it's time for us to work on those drivers and work more on the prevention. Because more on the we have response strategies, but if we do more prevention by changing the mindsets and so forth, the next generation may create a gender-based free society. Especially these strategies which are already in place, but they seem comprehensive, but they are not specific. For instance, you find that a lot of them, they have no special strategy targeting women and girls with disability. So can we go a step further in our analysis and program specifically targeted strategies for each category of a survivor? Thank you.
Thank you so much.
Thank you. Speaking of children with intellectual disabilities that we facing gender-based violence, we have these cases in our organization. And this is because before it was like a parent didn't know how to take care of children with disability. And remember, disability causes poverty, and the poverty causes disability. So you find that the father of the child has run away, so it's only mother who is taking care of the child. So we cannot sit there, sitting baby, while they don't have anything to eat. So what they used to do is to leave their children there and they take banana, avocado, whatever, to sell in the street. And then the rapists now know she or he is alone. That is when they will go open the door and abuse these children. We have numbers of these cases. But again, there are some of the cases like parents allow a houseboy to take care of a girl, adolescent girl. As a result, the houseboy abused the girl. So the parent had no understanding of disability. They didn't know that a girl with an intellectual disability can be abused or can conceive. These are the information, again, we need to pass to spread this word. So the girl felt uncomfortable. She was taken to the hospital and delivered a baby. And when she was asked, the neighbor had to say, the houseboy is the one who did this. So when we follow up with the government, we have very good Tanzania Disability Act 2010. We have good policies again, but without implementing them, they are nothing. Even if people with disability or community, we don't know this act and the police, if they will be put in somewhere in the office, gather dust, this is nothing, is wastage of resources. So when we follow up this case, what we face, the challenge we faced, the parent of the girl didn't want to come front because they feel like, it is embarrassing, the young girl has been abused. Even when the police intervened, they even said, they were in relationship. By the time the parent realized the girl was pregnant, the boy ran away. So we have these cases, but so what we are doing, we have a specific program for children and parents for children with disability and their parents, where they come together, they share experience, how they can take care good of their children, because this is the most important thing as a parent, to make sure your children are safe. So my call is, we may have a very good policy, very good act for people with disability. But if a certain group of people lock themselves somewhere and come up with this paper, it won't work for this. What I want to say is, let it be with us and not for us. Thank you.
Thank you so much. Over to you, Dan.
Okay, thank you so much. Sorry. What I want to say is that most of the people with disability, they are being abused by people well known to them. And what we need to do, we need to create more awareness and involve the local administration back to the grassroots level, whereby we can make these people access to the justice system, the PWDs, because you realize that they are abused by people in their same home state, by people in the same village, the same society. So they don't have anywhere to run to. They don't have any support system. You know, by being a BWD, you know, you need a lot of support. And for you maybe to pursue anything, you need a support system that will hold your hand. And that's why even now we are advocating for a safe space. We are engaging the State Department for Gender, whereby we want to make sure that each and every county has a safe space, so that in case we have these cases of GBV, we can even rescue these people, take them to the safe shelter, let them stay there as the case is being pursued. And I want to appreciate even the Kenya Police. They have come up with something called Polycare, whereby all the services regarding gender-based violence will be in it's a one-stop shop, where you'll get a doctor, you'll get a legal officer, you'll get an investigator. Everything will be done in one place. And then the matter is taken to court, and then it's being accelerated, whereby they make sure that the victims get justice. And then the other thing we need to do is to empower PWDs. Let's empower them. Let them know that they are not lesser human beings. They are human beings the same as the other people. Let's tell them their rights and what to do when they are being abused. Because lack of information is another thing that is, we find it hard to deal with the cases of GBV when we are handling the people with disability. So I believe when we incorporate everything and put these people, the survivor-centered initiatives will be able to handle these cases. Then my brothers talked about men being abused and they don't have somewhere to go. Yes, it's an issue of culture. You know, as Africans, we have been cultured as men, like not to speak, men, you are not supposed to cry. And those are the things that are affecting men, even when they are being abused. And as I said, violence only thrives in silence. The moment the perpetrator realizes that when she abuses you, you keep quiet, you don't have somewhere to go to, she'll continue abusing you each and every day. So I tell men, if you are being abused, just come out. Come out and talk about it. The day I came out, many men were telling me, oh, Dan, it's a shame to men, but the same people They are now coming out telling me that, oh, you are helping us. I meet people in town. Like, I wanted to commit suicide, but I'm happy that I listened to you, and now I'm living a happy life. Because the society has labeled men as perpetrators. They don't know. Nowadays, we have empowered women. Women have gone to gym. They beat men. So let's handle this issue of GBV holistically. Let's not try to justify any act of gender-based violence. Because the moment we try to justify, you say, oh, this was a mental issue, if it's a mental issue, let's take it to the psychiatrist, then they'll give a report. Let's take action and act on the cases of GBV. And then I want to tell each and everyone who is here, who is watching, we have, as an organization, we have this toll-free number, 1198, you can call. Right now we are transitioning, we are shifting. It might be off, but from tomorrow it's on. You can call, you can report cases of GBV. We have professional people who will help, will support you as the first point of support. Then we can follow up with the case. We are also coming up with an application. We engaged Jomo Kenyatta University. We are coming up with an application whereby people can be reporting cases of GBV. Even you don't need to call. You can go to the app, you can report, then we can get the case. We can, having a partnership with the police, we can reach you and we can offer support. Thank you so much.
Thank you so much. Round of applause for our panels. I think just to close off, also to just share, because I know our time is up, and thank you so much for being a lovely audience and an attentive one. I think I just want us to redirect the attention of this discussion to the current crisis we have in Kenya. And why I specifically wanted to mention this is due to the regard that there's still a lot of arrogance, there's still a lot of avoidance of this discussion. Femicide is the most brutal physical manifestations of gender-based violence, and Kenya is literally at the brinks and the depths of this darkness. In January, we were able to consolidate a protest nationwide, total shutdown KE, that was able to address this. This is also a clarion call, not only to us as persons on the ground working on these issues day to day. This is a clarion call to the government of President William Ruto, that it is now time that the 50+% of the population that is women should categorically be part and parcel of giving these strategies and working against femicide in the country. We are tired of counting numbers of dead women, whether with disability or not. We are tired of counting gender-based violences, and this is just a clarion call for us to not only have policy on paper, but to equally have policy in action functioning. And this is also a directive to His Excellency. Follow up on the 3 A's: accountability, acceptability, availability. Let things be available for those that need it. Let you be accountable as the head of state and your government to work on this. Let you be available for the people that actually voted for you. And importantly, let us have women, not only in spaces where they are victims, but in spaces where they can lead. And for persons with disability, let's not promote them in the aspect of them being victims, but in places where they can not only lead, but take full parcel responsibility of what they want to see differently done. Thank you so much for being part of this discussion. Bless your heart. Continue with the work that you're doing, and God bless you. Thank you so much.